Hi guys, hope you all doing well. I'm Dr. Vikas Illur. I'm consultant orthopedic surgeon in Aster Hospital. So today I want to discuss about a very common knee condition with respect to meniscal injuries in the knee joint. It's become very common and it's mostly related to sports related injuries. Although more commonly in India, other than sports related, it's also seen in when there is a road traffic accident. So first, let's come back to basics. What is a meniscus? So everyone would have heard of this meniscal tears, but what exactly is a meniscus? So the knee joint, is formed by two bones, femur and tibia, and there's a small kneecap bone in front of the knee joint. Okay, so in between the femur and tibia, there is a cushioning agents where there are two C-shaped or two wedge-shaped fibrocartilaginous structure which helps as a shock absorbers. Okay, so they are called meniscus. So there are two meniscus per knee joint. So one on the inner side, one on the outer side, what we call as medial and lateral meniscus. So normally they help in increasing the congruity and functioning of the knee joint, and they act as shock absorbers. But so what happens sometimes when there is a grinding force on the knee joint, where especially in football and other sporting injuries or in road traffic accidents, one of these menisci, usually the inner one, the medial meniscus, gets caught in between the bones and it tears. So depending on the tear, the treatment is going to change. So why are we worried about this menisci? As I told you, menisci is useful for the smooth functioning of the joint, and it has been proven time and again that if meniscus are missing, it leads to early osteoarthritis and degeneration of the knee joint. So we are worried about this meniscal tears. So what are the symptoms? The problem with meniscal tears are most of the time you are not aware that you're undergone a meniscal injury, because during sports you don't tend to really look into that, and you get a pain after a few days after your actual injury happens. And even the pain is very subtle and it comes and goes only in certain activities, when you try to squat or try to do stair climbing or trying to come down the stairs, or when you try to sit cross-legged, it's going to show up. So most of the time they are not really looked into. Very rarely you get little swelling, but not always. So usually the population which is affected is a young adult population between 20 to 40 years of age group, where their sporting activities is more and activity level as such is higher compared to the rest of the population. So how do we diagnose this? We need apart from a clinical examination, we need an MRI scan which will pinpoint which meniscus, which part of the meniscus is torn, and are they amenable for repair or not. So how do you treat? So either you resect or repair it. That's always a $1 million question. So when do you resect the meniscus and when do you repair the meniscus? So the menisci, as you take it, only the blood supply happens only in the periphery of the menisci, and inner 2/3 of the menisci there is no blood supply at all. So when there's a tear in a meniscus, when there is no blood supply, it's not going to heal even if they repair. So we are going to just resect it. How are you going to resect it? It's a simple keyhole procedure called arthroscopic meniscectomy. What we are going to do, it's a daycare procedure, and they can get back to their regular activities in less than 3 weeks with proper physiotherapy protocol. In case we decide to repair the meniscus, that looking into that, there's blood supply is still intact. There are various treatment options are available, where we put multiple stitches depending on one to many required to hold it in place. And then the problem with this is it requires a longer rehab period, where more than 3 months, 3 to 6 months it requires to heal. So the rehab period is also prolonged and you cannot get back to your regular activities till then. But once it is healed, it's as good as a normal menisci. So always, whenever possible, we tend to repair it and not resect it. For more information, please contact me at Aster Hospital, Department of Orthopaedics. Thank you.